The South African Health Products Regulatory Authority, SAPRA, in partnership with the Department of Health and other stakeholders, is hosting a webinar on mitigating COVID-19 vaccine hesitancy in South Africa. The country has rolled out the national COVID-19 vaccine program, which aims at vaccinating 40 million South Africans. Bishop Malusi Mpumlwana and Professor Hannelie Meyer from the National Immunisation and Safety Expert Committee were amongst the speakers.
What do you teach on vaccines? And I tell them what we do. And he says, can you talk to one of my employees because we are worried she doesn't want to vaccinate. So I say, well, if she wants to talk to me about it. So she comes up and says, I will not vaccinate because my pastor has fasted for 21 days and came out and said none of his congregation will ever have COVID because he has fasted for 21 days. She says, I don't compromise on my faith. I will not until, and so I said, but what, do you really believe that just that fasting can prevent the virus getting onto one of your members in your church? She says, well, I've asked the wife of the pastor, and the wife of the pastor says, if I think differently, I must pray about it and God will tell me. So until God gives me a sign, I will not do anything else. I say, have you considered that God might be talking to you through other people, through the webinars, through all the information that's around you? And she says, well, I don't think so. I want to hear it directly from God. You know what happened last week? Last week, I was going through the same shop to buy something, and this woman comes up to me. Do you remember me? I said, not really. She says, hey, I've just taken my jab. I'm the one that was talking to you. So I suppose God did talk to her. So it is really to say the key thing is to empower the people of influence at every level. And I want to say, if I'm just going to bring this to a close very quickly, is to say we need to recognize that the sanctity of life is paramount and everything must be done to save lives. We cannot have a faith tradition that is able to live with the death of people in the name of God, because that's actually what you call human sacrifices for religion. And that cannot be the case. We ought to have a faith that preaches the sanctity of life, that says, have mercy, for your heavenly Father is also merciful. We believe that this is possible. We get people vaccinated against the virus in order, and that in itself becomes an act of charity because you prevent the spread. There are people who cannot take the vaccine because of their conditions of health, and therefore those people will benefit if 67% of us or 70% of us have been vaccinated. And for this reason, the Religious Forum Against COVID is campaigning that 7 out of 10 people in all our congregations must be vaccinated. And that is 70%. That can then be our contribution. And we're appealing that everybody and every organization that has got a constituency should try to persuade 7 out of 10, your friends, your neighbors, your family, everybody, 7 out of 10, please get them vaccinated.
All right, so to add on to what he said then, this is where we are at the moment. So I just want to remind everybody that we are still in the third wave, and we hear on the news and we read in the papers that there will be a fourth wave coming. We don't know exactly when. If we look at where we are in terms of vaccination, as you can see there, we have now vaccinated 22% of our whole population, not adults specifically. This is now the whole population. And then we compare it with the rest of the world. We're like halfway. Although if we compare ourselves to Africa, then we are quite ahead of some of the, or most of the other countries. Now, there's some predictions that's being made by various groups, and this is being done by PwC. And as you can see, they actually pointed out 3 different scenarios: upside, baseline, and downside. Now, I'm sure we all want to go to the upside scenario where we can move through Christmas, maybe lockdown level 2. We can go down to lockdown level 1 again next year. And then by April, May, we can relax a lot of these restrictions and, try and go back to our normal lives. But we need to vaccinate 70% of the adult population by Christmas. That is the aim of the Department of Health. Now, where are we at the moment? So if you look at this graph, the picture doesn't look so promising. So the question is, are we actually going to reach that 70% that we are supposed to be aiming for? And if you've been, watching the numbers of vaccines being administered at the moment, then you will see that our numbers are really quite low, while we need to aim for about 300,000 vaccinations per day. We are really way behind on that. Now, if we look at, what there's been various surveys. Now, this is data from the Johns Hopkins Center for Communication. And if we look at how many people is actually not willing to accept the COVID-19 vaccine in South Africa, and this is quite a large sample of people, about 25,000 plus. And as you can see here, it's over the 30%. Say they will not take a vaccine, and then there's this group here sort of in the middle which say, probably I'll probably not get it, and then the orange group will say, I'll probably will get it, and only the blue groups, yes, I have been vaccinated, or I'm definitely going to get vaccinated. Now, what are the reasons? So Flora also actually mentioned some of these, and as you can see, the top reason there at the top of the screen is the concern about side effects. Now, all the surveys point this out as the very first reason why people do not want to get vaccinated. People are worried, they are scared, they hear stories and so on. Quite a number of them also say, I plan to wait, I'm waiting, I want to see what's going to happen. And that is not a good thing to do. And I'll point that out in my presentation as well. So, with all these unanswered questions that people have, they create a lot of uncertainty, confusion, and fear. And the bishop also pointed out that we need to communicate, we need to educate. Flora also spoke to that. We need to make sure that people actually get the right information. And the question is, have we been, successful enough, efficient enough in making sure that the right...
Well, a bit of a break. We'll be back in a moment.